Thank you, everyone. All right, we'll get right back on it. And agenda item 11, discussion and consideration of provisions for remote processing. The last item for discussion is consideration of the board's. Oh, before I do, I'm going to take a roll call. Trevor?
Here.
Thank you. Jesse?
Here.
Thank you. And I am here. All right, the committee will continue. The board's legal. Trevor, did you have a question?
Yeah, sorry, I was just wondering, given that we don't have quorum, and this is my first time being in a Board of Pharmacy meeting without quorum, like what's the nature of the next discussion? Do we just decide we're not going to make a decision now that we don't have quorum? What's the nature of what comes next?
Thank you, Trevor. Yes, it is. We're just going to discuss it. We'll have public comment. We'll go through all the comments, but we will not be able to make a recommendation as a committee. So we just won't be able to have a motion. Eileen, did you want to add anything?
Yes, I was just going to state the same thing, President Owen. Then at the board meeting, because we don't have a quorum of this committee, then any motion it would normally make won't be there, which means at the board level, we're going to have a motion and a second if the board so decides to go forward.
All right. With that, members, the last item for discussion is consideration of the board's legal requirements for remote processing. To facilitate physical distancing early in the COVID-19 pandemic, the board approved a waiver to extend the provisions for remote processing. The waiver is based on the board's authority in Business and Professions Code Section 4062 and is limited in duration. Because of the length of the public health emergency, I believe there may be some licensees that have become accustomed to working under the remote waiver. Last year, the board voted to pursue legislation. However, the measure was controversial and as such failed to move early in the year due to significant opposition from all stakeholders, coupled with a lack of support and engagement for the measure. With remote processing waiver set to expire, the board was asked to again consider if changes to the board's laws are appropriate. The meeting materials note, just for that comment, just also want to add the board's laws we are not able to change the laws. That's the job of the legislatures. The meeting materials note the relevant section of the law that establishes authority for remote processing. Through the years, it appears that some may have overstated the provisions and flexibility provided in California law. The approval and release of the waiver then appear to cause a stir among some that may have implemented practices that exceed what the law currently provides in California. We're not today here to discuss this. We're going to try to discuss what's moving forward. Under the conditions of the waiver, however, the board expanded authority for pharmacists to receive, interpret, evaluate, clarify, and approve medication orders and prescriptions, including such orders for controlled medications. The waiver allowed for order entry, other data entry, performing prospective drug utilization review, interpreting clinical data, insurance processing, performing therapeutic interventions, providing drug information services, and authorizing release of medications for administration. The waiver does not permit dispensing of a drug or final product verification by remote processing. Although the waiver has been in place for a significant period of time, it is limited in duration, and unless legislation is passed at the end of the waiver, provisions in the law will return to those currently allowed in 4071.1. Before we begin our discussion, I'm going to ask counsel to remind members about the general structure of pharmacy law and practice and how it is related to this issue. Eileen?
Hi, President Owen, committee members. We've heard at different meetings from commenters about statements that somehow the board's new interpretation is new. It's not new, and basically, the structure of pharmacy law and certain definitions generally tie where I would call the traditional pharmacy, storing, preparing, dispensing, that is narrowed to the location of a pharmacy that is identified in a license issued by the board. A lot of commenters have tried to state that the definition of a pharmacist that says that they're entitled to practice pharmacy as defined by this chapter within or outside of a licensed pharmacy, but they leave out the last part of that sentence, which means as authorized by this chapter, which is an important limit. There are different provisions in section 4052 that allow the practice of pharmacy in other locations, including hospitals and other parts of pharmacy law that allow that. But what I would say is 4071.1 is the only authority in pharmacy law governing basically the prescription dispensing and storage process. And so if you want to expand 4071.1 to include some or all of the activities that were authorized by the board's emergency waiver power into permanent law, that it needs to be done by statutory change. And it's going to definitely, for interns and pharmacy technicians, there is no statutory authority for them to do anything outside of a pharmacy. And pharmacists' ability to be able to input, interpret, and anything related to what I call the dispensing process for a prescription is currently narrowed to the location of the pharmacy identified in the license issued by the board. Accordingly, just as you had stated, I would suggest that the board and commenters concentrate their efforts and comments on evaluating, based on 3 years of working with the expanded provision of remote services allowable under the board's remote processing waiver, where they think the permanent law should be, and concentrate on explaining why such changes are necessary and appropriate and how they can be done safely with due consideration and concern to the security of the prescription ordering and dispensing process and patients' rights under both federal and state law and the California Constitution to their right to privacy for the treatment and access to their medical and financial information. And I would also suggest that committee members, again, the Q&A format is not intended to, for commenters to pose questions to the committee members about what they may or may not do with specific remote processing that may have been done in excess of current California law before, and just to concentrate on where everybody believes the law should be. Do the members have any questions? President O, I'll turn it back over to you, and let the minutes reflect that the members had no questions.
Thank you, Eileen. Thank you for your quick summary and overview, and I appreciate it, and I'm sure we'll be needing your assistance throughout this discussion. If you can just be ready for us, we would appreciate it. All right, so we will begin discussion of the meeting materials, which detail out a number of policy questions for us to consider. Feel compelled to highlight that it is essential that when we consider these questions, we are mindful of the possible unintended consequences of our decisions as well. As an example, the board has been working diligently to reinforce the vital role pharmacists in charge must play in ensuring operational compliance with the requirements of pharmacy law. We need to also ensure that decisions we make do not undermine our efforts in that area. I also believe it is important to be mindful that regrettably remote access to computer records is a primary way billing fraud is conducted with the activities occurring outside of the oversight of PICs. We should not be taking any actions that will usurp the authority of the PIC. Also, we need to be mindful that pharmacists working in community pharmacies provide a unique and important access point for healthcare services for many Californians. It is important that our actions do not diminish the ability for patients to access this care in this setting. As we consider the various questions included in the meeting materials, I would like to suggest that we also consider if we need to predicate in any legislation moving forward on the benefit to patients and provisions to ensure pharmacists and community pharmacies are made available to provide these patient care services where remote processing as described in the current waiver or as we determine appropriate would be allowed. We'll now begin with the policy questions. And before I start, I'll give the members opportunity to say any global statement before we go on. Seeing none, we'll get started. And as there are a number of policy questions for us to consider, I intend to first discuss them as a committee to see if there is a common ground in at least some areas. Periodically throughout our discussion, I will open up for public comment on the committee's discussion, about 5 questions at a time. So first question, after May 28th, 2023, is there any continuing need for expanded remote processing authority? Should the law revert to the allowance under BPC section 4071.1 subdivision A only for remote order entry by pharmacists and prescribers and their agent? Is even that authority for pharmacists remote order entry still necessary? Should this answer depend on the type of prescription, outpatient versus inpatient? I'll start with sharing my thoughts. I believe there is definitely an opportunity to expand the current authority under BPC section 4071.1, but we must proceed very cautiously. I believe the need for the permanent authority resides more acutely within patients, where regulations such as CMS require that non-emergency orders be reviewed by a pharmacist prior to administration. As not all hospitals have pharmacists on site, including critical access hospitals, access by services of off-site pharmacists need to meet these requirements are necessary to ensure continuity of care and to ensure compliance with regulator requirements. I would suspect this dynamic is most acute in rural areas as well. Members, your thoughts? Jesse?
Thank you, President O. I don't think the demand is where it was in the beginning of the pandemic, right? With everyone coming in, getting months worth of their medications at a time because we didn't know how long everything was going to go on for, and then moving into when COVID vaccines first happened. I mean, the overwhelming workload in pharmacies at that point is not what it is today. Granted, just reviewing some of the public comments that were submitted, and there seems to be a common theme that there's still an obvious understaffing issues within pharmacies. But I think that also needs to be addressed, which doesn't necessarily have to only be addressed by remote processing. There's issues regarding physically having people in the pharmacy, and that's something I think we need to look into further, and which we are looking further into, particularly with the Medication Error Reduction Committee.
Thank you. All right. And it's a small group of us, so I guess we're gonna actually move pretty quickly. So we're moving on to the next question. I won't force all of us to answer unless you strongly feel one way or the other. So we'll move on to the next question. What use was being made of the remote order entry provision prior to the waiver and the pandemic that prompted the waiver? What do the stakeholders anticipate being the need for remote order entry or remote processing going forward? Is there something beyond what is already permitted by BPC section 4071.1 that will be required? I am familiar with some few enforcement matters where portions of the dispensing process were being conducted in unlicensed locations by unlicensed personnel. Based on the public comments received recently at meetings and the written comments received in advance of the meeting, I believe stakeholders are interested in permanently expanding some provisions for remote processing. Jess, your hand is raised.
Sorry, I always forget to put my hand down, but yeah,
that's okay.
I'll comment on this one too. I will say I personally have experience prior to the pandemic of a bit of remote order entry, although looking through all this, it seems like the system that was in place at the pharmacy at the time maybe was going beyond the scope that's actually allowed. It's my understanding that the remote order entry is inputting the prescriptions into the system, not actually verifying the data, separate from product verification. But I do have, so in that scenario, essentially what was happening is that lower volume pharmacies were given the opportunity to assist larger volume pharmacies with their workload, which did, I think, alleviate some of the workload. And I've experienced with the waiver as well, being able to help other pharmacies and having other pharmacies help me assist in that process. So I think there could still be a need for remote order entry. And I think I'm sure we'll probably hear more comments about that.
Thank you, Jesse, for the comment. I am actually going to put a spot on Ann. I'm sorry. I don't mean to put you on an uncomfortable position, or Eileen, but I just want to make it clear that remote order entry, I think remote processing, we're talking about not at site. We're talking about off-site, unlicensed site. So I just want to make that clear. Trevor?
So
actually, Ann, go ahead. Yeah.
So I think that that's one of the policy questions for you all to contemplate, right? I think what Jesse was describing, it sounded like perhaps it was a pharmacist at one licensed location helping pharmacists at another location. I think that that's potentially, a different model than maybe what was contemplated under the waiver, which was allowing it at an unlicensed location. So I think that, there's different, I think that that's part of what this discussion is maybe all about, is what do you feel is appropriate, and then kind of developing a proposal from there. Sorry for the interruption. I apologize.
Thank you, Ann. Trevor?
No, and actually that's right along the lines of kind of where my general thought process is. I have kind of individual thoughts on each of those, but kind of this question kind of hits on my broader perspective of, we want to, I think there's always opportunities in a crisis that we can learn from moving forward. And I think the fact that so many folks and pharmacies have used different versions of remote processing really gives us a unique opportunity to rethink this. But also our primary responsibility is always in favor of the consumer, and especially protecting consumer privacy. And I do have significant concerns if very sensitive information such as prescriptions and all of this is happening at someone's home versus an in-person in an actual licensed facility. We're talking about people whose Wi-Fi connections or whatnot, there's no, beyond having a VPN, who knows the security that's able to be had at a home location. So that's a significant concern for me, especially we just had a whole conversation about the stigma around HIV/AIDS medication, as well as a potential stigma that could come if that information was accessed because of a poor network security at a home Wi-Fi, or potentially someone doing this at a Starbucks because the house is too noisy. And so that's a real significant concern of mine. First and foremost. Also, I believe if there were, I'm really intrigued at this potential that Jesse was talking about of smaller pharmacies actually possibly being able to make revenue by assisting larger pharmacies with these sorts of things by using their on-premises processing as an avenue there to potentially add their capacity. It allows them to be able to generate additional revenue if they have the capacity to do so, which helps not only the small pharmacies, but the larger pharmacies as well, depending on what's happening there. And I also think by happening on premises, it'll prevent any potential for labor issues, whether making sure that people obviously like take the breaks they need and all of these things. That's obviously more subjective and can get blurrier the further and further away you get from the in-person dynamic of all of these things. So I think there is a definite opportunity for us to rethink this in a way that benefits everyone. But I will just state my significant concerns about continuing to allow completely remote processing, especially in addition, I've obviously already made clear my personal passion around the opioid epidemic and making sure that we have eyes on all of these in person rather than from a laptop in a Starbucks. Is something that I want to make sure we're sensitive to make sure that the full attention is on these. And there's something to be said for the convenience of remotely from a house or from an apartment, but there's also something to be said for the the more, nothing is ever guaranteed, but the more effective accountability of eyes on the screen and full accountability of being on premises as well. So it sounds like there's some potential avenues we can navigate to maybe create the flexibility that's been requested. But those are kind of my general thoughts as of right now.
Thank you, Trevor. Jesse?
Thank you. Just going off of what Trevor said, I have the same privacy concerns. I also have significant record keeping concerns. Just trying to think logistically, if someone's entering hard copy prescriptions, how do they store them in a home or in a place that's unlicensed? If they're taking prescriptions over the phone, is this person having prescription pads in their home? How do they secure it and ensure no one else has access to it? Those things are very concerning to me. And I'm glad that Trevor also brought up the ensuring that we're actually complying to labor laws, making sure that people get their breaks, their rest periods and their meal periods. And I think I had one other note here. Oh, and the other big question too, when we think of a community chain setting versus a hospital setting, and it may be different. I'm actually curious to hear some feedback from hospital pharmacists as well during public comment. But just thinking from the community chain setting, just making sure that there's no quotas if remote processing were to be made permanent, that the quota bin would extend into that. And I guess that's more of a question for council, or maybe a question for a later date, but making sure that the remote pharmacists aren't being overworked either.
Thank you, Jesse. Trevor, do you have any other comments? Oh, okay. All right. With that, we're going to go for question 3. Have operations, and question 3 is loaded, so we gotta get a little lost. Have operations under the waiver revealed benefits to expanded remote processing authority that are worth carrying forward into a post-pandemic regulatory environment? So just would start with there. I believe that some provisions are the waivers are vital for inpatients, especially and maybe community, to ensure patient care, including authorizing the release of medication for administration. To me, I believe if we cannot reach consensus on anything else, we must ensure inpatients receive the medication they need. And then I believe some comments received appear to indicate that there may be benefits to pharmacists who appear to have gained a better work-life balance through provisions of remote work. But for other pharmacists, I believe remote work makes the job more difficult. So I can also recall a recent disciplinary matter involving several pharmacies under common ownership that bifurcated out the dispensing process, and the bifurcation of the process resulted in medication errors and a failure to exercise corresponding responsibility. So this case highlights some of the challenges with remote processing provisions. So I'll stop there. Jesse?
Thank you, President O. I wrote down some of the risks and benefits myself. So some of the benefits, obviously, it has the potential to alleviate the workload for pharmacists, particularly in the community setting, and making it so that people don't fall behind on work and end up just always behind. The other thing that was noted in a few of the submitted public comment or written public comment was that it increases accessibility for people to work. Persons with disabilities or people who may be on leave of absences or not able to stand for long periods of time would be able to work from home, which is a huge benefit and makes the profession more accessible. Also, it seems like people said that they could verify without distractions. And of course, a big one is the reduction of COVID exposure and potentially not transferring it to their coworkers. I'm sure pretty much everyone has experienced or seen a pharmacy in which one person gets COVID and then all of a sudden every single staff member does. So that is obviously a huge benefit there.
Thank you. All right. So I'm going to go to the sub questions 1 and 2. I'm going to kind of So is it desirable to permit pharmacists to also remotely receive, interpret, evaluate, clarify, and approve medication orders and prescriptions, including medication orders and prescriptions for controlled substances? And is it desirable to permit pharmacists to remotely perform tasks like order entry, other data entry, all the waiver included items? I say there are benefits, definitely, and in allowing ability to do so. So, any other comments on those?
Hey, Sung, it's Jessie. I have concerns about remote verification for controlled substances. I would probably limit it to non-controls.
Okay, because of the corresponding responsibility.
Yeah,
concerns,
corresponding
challenges.
responsibility, and
I can see that. I mean, I think that was the concern because, I can see that. Trevor?
Yeah, I mean, this is where, I mean, maybe I'm just focusing on the phrasing too much, like desirable. I mean, in the end, is it desirable for a lot of these things, kind of in isolation? Absolutely. Like, I think a lot of these, on their face, without having to look at, like you kind of referred to, Sung, President O, we deal with a lot of these disciplinary cases at every meeting we go to. And as I'm looking at this, I want to make sure that we're, obviously our core goal is protecting the consumer. And I look at a lot of the issues in the disciplinary matters we faced just with people in the on-premises pharmacy, and the issues that were able to be corrected and addressed because of the accountability at an in-person pharmacy. And as I'm looking at all of these potential avenues, I'm thinking of what might not be caught, or what might be missed by moving these off-site or fully remote. And so, do I think a lot of these are desirable for a work-life balance? Absolutely. And I think we need to really work to make sure that we're trying to figure out the most effective way to create that work-life balance for people with disabilities who want to be a part of the profession, all of these things. But I just think, especially my mind keeps going back to all of these disciplinary matters, and wanting to make sure that it is done in a way that ensures accountability, ensures redundancy, in a way of making sure that we have to imagine the worst case scenarios. Let's imagine we have a bad actor or a bad apple, or someone who's in the throes of their own addiction, working from home, in this manner. What do we need to watch out for? What do we need to put in place and institute to making sure that if we do have someone who's in their own addiction, or if we do have someone who's a bad actor, what processes are there? And so that's when I'm looking at these potential desirable options for work-life balance. That's also where my mind is going, to make sure that we're protecting the consumer through all of this.
Thank you. Absolutely. Jessie, did you want to say anything further?
Yeah, just adding on to the controlled substance issue, I think really the big issue I have for it is that I strongly believe that a dispensing pharmacist should be the one making the decision as to how and when they're going to be dispensing a controlled substance. And then that obviously gets into the issue for all prescriptions, not just controls, of who is liable for anything that goes wrong. If a DUR is missed, if there's a drug interaction that's missed, something, is the PIC from the dispensing pharmacist liable? What liability is actually on that remote processing pharmacist? So these are some of the big issues that kind of come up the more I think about it.
Absolutely. That's why this matter seems simple, but it's not simple at all. So that's why we're here. Okay, so we're going to move on to the next part of these lots of parts questions. If you could advance, Elizabeth, please. All right. So is it desirable to permit pharmacy technicians and pharmacy interns to remotely perform non-discretionary tasks, including prescription order entry? I'm not going to read the whole thing. I think you guys have that. I am going to say that I would love for us to have a discussion on this eventually, but it is way too premature. We are not on the same page on pharmacists. So I would just recommend that we don't even really contemplate this at this point, and to minimize any confusion that may cause. Hopefully that's okay. All right. So next is, are there other functions that pharmacists or other pharmacy staff should be allowed to perform remotely or from a non-pharmacy location? And I'm gonna leave this open. So I would limit it to what Jesse was saying. Probably is a good idea to start there, non-controlled substances. And you know, I think in a perfect world, we always say technology will solve everything, but I just have to say, being mindful that I've worked long enough to see so much things that could go wrong that I would caution the reason or excuse or how to justify this just to be technology. I just really would recommend that there has to be something further beyond, and that's how I feel about it. Just saying technology will resolve everything and this is not going to happen. I just think that that's absolutely not an appropriate and enough response to handle and the decisions we're making. So with that said, I think there are a lot of opportunities, especially consultation and inability to help pharmacy teams in the pharmacy in being able to act fast, act without being distracted, because there's a lot of distraction in the pharmacy as well. So with all that, I'll open up for any thoughts to you guys.
Hey, Sung, it's Jesse. Yeah, I think there are some tasks that would be reasonable. Obviously, like I'm sure remote positions for like insurance is submitting prior authorizations, MTM, things like that. But again, the security of the internet and the computers that people are using is still something that needs to be addressed at some point. And I am by no means an IT expert at all. So that's something I'm totally unfamiliar with.
I hear you. Same here. All right, so we'll go to the next question. This is more probably for the staff to respond for us, but what does the data reveal about the use to which the waiver has been put? And what can the stakeholders share about perceived benefits and risks of remote processing? What are the technology solutions that best facilitate remote processing? Have there been advances in technology as a result of expanded authority under the waiver? I'm just going to defer this to our staff. And if you know anything.
So I cannot speak to the technology. I will say that people definitely took advantage of the waiver. When the waiver did expire, we received a number of requests to extend the waiver. I would also say that we did have the opportunity to investigate some use of the waiver that went beyond the provisions that were allowed by allowing, non-pharmacy personnel to use the waiver.
All right, thank you, Anne. I say we move on this one, but I will ask when we open up for public comment in just a little bit. I would like to ask stakeholders to share their thoughts about perceived benefits and risks of remote processing and the technology solutions that best facilitate remote processing. All right, moving on to the next question. Policy question 4. I'm sorry, the numbering I think is incorrect on the meeting material, so apologies for that. So if we do believe some sort of remote processing is needed or helpful in a post-pandemic regulatory environment, under what circumstances should these additional tasks and functions be permitted? Should it be limited only to pharmacists, as is remote order entry under 4071.1. I do believe it really needs to be limited to pharmacists at this point. And that I would just be cautious of expanding it any further at this point. Unfortunately, we have to take a little step at a time. And Jesse, go ahead.
Hi, Sung. Yeah, I completely agree with you. I imagine virtually to try to supervise or coach someone is going to be extremely difficult. And I think as a first step, it makes sense to, if we're looking at it, to just limit it to pharmacists.
Thank you, Jesse. Trevor, anything else? Okay. All right. So public comments. We're going to open up for public comment on the first four questions. Just please focus on the first four questions. I'm hoping that, Elizabeth, you could display, well, probably not possible, but hopefully we can kind of guide people through. And I'm sure there will be quite a bit of public comments on these topics. So please, Elizabeth, we're going to allow, due to the length of these questions, 5 minutes per individual, 5 minutes per individual. So please open the line for public comments, Elizabeth.
Yes. The Q&A is now open. The instructions are on the screen for your reference. If you're logged in and would like to participate, click the question mark inside of the square and type comment in the text box that appears. Make sure it goes to all panelists before clicking send. For those who are calling in, you can raise your hand by pressing *3 from your phone. And I see 2 hands are up and there's a request through the Q&A. I will receive, if you submit it once, I will receive it. So please be patient with us. Thank you. So we'll first go with Cartia. I apologize if I'm
That's our fellow board member, KK. Hi, KK. Welcome. Thanks for crashing the meeting.
I'll send a request to unmute microphone. And I set the timer for 5 minutes. And I apologize, mispronounced your name.
Hello, good afternoon, everybody. I hope you can hear me.
Yes, we can.
Okay, thank you. I won't take 5 minutes, very briefly. I think I support keeping some sort of remote processing going forward. I definitely enjoyed the interactions and the discussion that happened before the public comments were open. I think what COVID pandemic has showed that not just when people are sick, but when they're also serving those 2, 3, 4 days of isolation, they're productive. They're not necessarily sick, but they don't really want to come to work and be contagious and so forth. Staffing availability, the number of people who can do certain tasks, especially certain pharmacists that do specialized work like TPN and IV in certain settings, they're not widely available. You know, of your pool of 15 pharmacists, maybe 3, 4, 5 are trained to do so. So this really helps pharmacy expand or keep their services and allows us to operate in the environment where staffing is some or adequately trained staffing is sometimes not available, and this allows to share the pool. So absolutely support keeping some sort of remote processing by pharmacists, of course, not by technicians, by pharmacists retained even after the pandemic emergency is over. Thank you.
Thank you, KK.
Next individual identified as Neil Mehta. I'm going to send a request to unmute your microphone. Request has been sent.
Board members and participants, can you hear me?
We can. Thank you.
Okay, thank you. Yeah, my name is Neil Mehta. I'm a pharmacist in the Los Angeles area. And I've been working remotely, for almost 2 years. And I just kind of wanted to share my experience because prior to this, I didn't even know it was possible, to be honest with you. And from what I've experienced, I've learned a lot. On a personal level, it's been a lifesaver for me. I do have some medical issues, like ulcerative colitis and some other things that was kind of making it difficult for me, working in like a retail setting. and I've moved to specialty. I should make that clear. I do work for CVS Specialty, and just the quality of life has really improved on a personal level. That being said, right now we also have people in my household that have COVID, and working from home. I am working, today every day. If I was probably having to go to a location, I would be quarantining. So that's kind of been an added bonus. But I kind of wanted to focus on the technology. I know not everybody's like really IT savvy, but from what I've seen with the use of VPNs, with their computers being locked, and being constantly monitored by our company, including all phone calls being recorded, I've kind of seen how the technology has benefited us, and I truly believe that it is there that can safeguard patient safety, as well as for us to be able to do our work properly. I just kind of wanted to share that, and there are probably some things in technology, but overall, I feel like it is very possible to have this remote processing. Thank you.
Thank you for the comment.
Next individual, going back to the Q&A feature, and then we'll jump back to the hand raise feature. So Roya Murfold, I'm going to send a request to unmute your microphone in just a moment. Request has been sent. You are now unmuted.
Can you hear me?
Yes, we can.
Oh, perfect. Thank you. Yes, my name is Roya Murfeld. I have been working retail for 10 years, and then I switched to work from home as a health outcome, clinical, and sometimes data review pharmacist for a chain pharmacy. And I mostly focus on medication adherence and patient education. I've been really lucky to get this opportunity because of major health issues and intermittent mobility issues, where I really had a lot of surgeries. And I mean, if I was in the store, I would have to call in and have a closure because of like some of my issues. I really had to step down basically and go to work from home. So this is keeping me, employed in this profession. I believe many other work from home pharmacists may have similar health issues or limiting family situations where outside of just like COVID and, quarantine, where remote work is allowing them to remain in the workforce. And I think we're already shorthanded in a lot of locations. So this is important to have this additional help. It increases access to patient care. And generally, there is a healthcare professional shortage as well. So it's not just pharmacists. The remote processing waiver was really essential during the pandemic and, riots and during the natural disasters and earthquakes. I think it's going to continue to be essential because it really helps with the workload and the retail staff. When I work for retail, I mean, some places are really hard to staff. I mean, it's not just the work condition, it's like the technicians don't want to drive to this remote location or whatnot. Like you really need remote help. So I think it's really helpful. Also, it's when I'm at home in my office, it's like there's no distraction, there's no one else here. So it's more accurate when I do verify prescriptions, it's faster, it's better for patient safety, reducing error. And then the pharmacist at the store has more time to actually catch up, consult, do immunizations and whatnot. So this really is helping the patients. I mean, they're standing in like huge lines, is what I'm hearing. And then also from my perspective, as a health outcome pharmacist, I do a lot of one-on-one, like 30, 40-minute consultations that really like help the patients because they don't get this type of time from other healthcare professionals, basically. So it's a win-win. It's for the patient, for the business, and for the pharmacist. And it helps the environment since I don't drive anymore. I got rid of my car. So I really think the waiver should be renewed and to give time for the board to figure out what's needed to put in some type of permanent measure, at least for pharmacists to practice remotely, as far as policies and regulations. I think some of you already mentioned that people with disability or accessibility issues, and just keeping up the workforce and letting us work as a pharmacist, not have to look for a different career.
For the comments.
This is the moderator. Moving on to the next individual identified as Keith Yoshizuka. Going to send a request to unmute your microphone. Request has been sent.
Thank you very much. Keith Yoshizuka, California Society of Health System Pharmacists. I have two comments, one for each venue. On the inpatient side, thank you for acknowledging that the application for acute care hospitals is vastly different. The requirement for review of medication orders before they're administered, particularly in these critical access hospitals that can't afford to have a pharmacist on site 24/7. So having this ability for remote processing is critical for the continued existence of these hospitals. On the outpatient side, I am aware that the board may be taking action, but I want to caution not to be overbroad so as to possibly exclude the existence of existing call centers that have been operating for the last 30 years, where prescriptions are called into input into the data system and sent to the location pharmacies for dispensing. This has been such a lifesaver having been an employee for Kaiser Permanente for some 17 odd years, and that was really a boon to relieve the burden of the workload at the location pharmacies, and it actually reduced medication errors because there were fewer distractions. There were no phone calls. Thank you for the opportunity.
Thank you, Dr. Yoshizuka.
Next individual, Clint Hopkins. Going to send a request to mute your microphone.
Hi, can you hear me?
Yes.
Hi, a couple of comments to add on there. So the first thing I'd like to point out is that we use remote access to the pharmacy, all of the pharmacists here do, and we use that for after hours emergencies so that we can service our hospice clients. So I'm able to log in from my laptop or from my cell phone and put those orders in remotely so that the automation that's here in the pharmacy, the robots I have, are able to package those medications and have them ready so that when I show up at 2 a.m, I'm here for 5 minutes instead of half an hour so that I can get in and out of here on my way off to go and deliver those medications to those patients who need them very quickly. It also helps me be here in the pharmacy less time in the middle of the night, which is a safety issue for me because we have unfortunately been broken into 3 times in the last about 4 months. And I don't want to be here at 1 a.m. when they come through the window with a sledgehammer. So we like that remote access option a lot. Our other concern would be about limiting to data entry at a licensed site. So we do a lot of mobile vaccination clinics, and we are somewhere, we could be out in the field, literally under a pop-up tent with a laptop. I could also be in a facility that's licensed, but not a pharmacy, like a skilled nursing, assisted living, that sort of thing. And I am doing that data processing in that facility. So we would need to take that into consideration. I'd also like the board to consider that there are technological advantages or advances that allow remote verification. The pharmacists actually get to see the pills that are put in the bottle, see a picture of the bottle itself with the patient's name on it. There's more to it than just looking at the order that was typed and the data that was entered. You're actually seeing there are systems that allow you to see every step in the process of the filling of that prescription. And, I want to make sure that that's taken into consideration. And then the last two comments I have to tag on to what some of the other folks have said is if we were to not allow this, there would be people that are very qualified that we would be removing from the workforce or potentially losing them to another sector of healthcare. And specifically, the second part of that comment is that the health plans and the PBMs have had folks working from home across the country and around the world for decades. And we don't regulate how those folks work at home. So we should consider that when we are regulating how our pharmacists and our pharmacy technicians are working from home. Thank you for the opportunity to comment.
Thank you, Dr. Hopkins.
Next individual, Doug O'Brien. I'm going to send a request to unmute your microphone.
For considering these questions, I work for Kaiser Permanente, and I wanted to talk about the inpatient setting and just emphasize some of the things that have been said already, which I greatly agree with. So. And I'm now just speaking about the hospital setting and pharmacist only, and actually not talking about processing prescriptions, but really medication orders that are, penned electronically in the computer systems for physicians, which are then routed to pharmacists for verification. And in most of our hospitals these days, we also have automated dispensing machines. So once that order is verified by the pharmacist by reviewing all the clinical information and approving it, the medication then becomes readily available to the nurse, instantaneously out of the automated dispensing machine. So these remote processing processes really give it a lot of advantages. I think during COVID, especially, because we did have areas that, one pharmacist would get COVID or a technician would get COVID, and it would spread to everybody else in the pharmacy. So very helpful that way. But also was mentioned earlier, in small hospitals that don't have a pharmacist there 24 hours, the pharmacist on call can actually review that order just as if they were in the hospital for all the clinical needs, verify that order, and then release the med in the automated dispensing machine immediately. If they had to wait until they actually arrived at the pharmacy and to do that, it would definitely, cause a delay in patient care. And then also wanted to mention about specialists and a little more about specialists. So, in some hospitals that don't have specialists, these specialist pharmacists can review these orders remotely and verify them and make sure that they are safe and effective, then release the medication so that it can be given by the nurse. So you're actually improving patient safety by using your specialists in a, in that type of way. And it also, bridges across hospitals to protect patients. Now, all of our people that have ever done this to remotely, verify orders that way, we do it all through the secure network. So it's, the secure VPN network from home. So it's totally secure, can't be hacked. And we have very high standards related to that security. And then as far as around controlled substances, I would say that the hospital side is a bit different. So think about acute needs for a patient and acute pain, and that controlled substance sitting in the automated dispensing machine, and it's a hospital patient now. And you could remotely review that order and make sure it's appropriate and release that so that the patient could get that medication right away. We wouldn't want any delays in that process. So I do think the hospital world is a bit different than maybe some of the other settings, but there are, tremendous advantages to having this remote processing ability. And again, not speaking about, say, discharge prescriptions or outpatient prescriptions, really talking about inside the hospital medication orders for patients inside the hospital. So I greatly appreciate you taking comment on us and considering all these questions, and thank you for listening.
Thank you so much. Thanks for the comments.
Individual and Inas Anton, and a request to unmute. Just a moment as I locate. Request has been sent.
Not hearing anything, Elizabeth. Oh, there. I think it's, yeah, okay.
Can you hear me?
Yes, we can hear you.
Of course. Thank you so much for giving me the opportunity to comment. I'll try to make it as brief. My name is Ines Anton. I'm a California licensed pharmacist for 10 years now. I worked for CVS Health Retail for 8 years, and I actually got hired to work for CVS Specialty Front End on January 2021. And I got trained remotely and I became proficient at my job without any issues through some on-site, but all the remaining of training was online. I was able to perform all essential duties of a pharmacist while working remotely without any issues or rising concerns, because we have the opportunity to work complete everything digitally and remotely in a safe and private work environment. We have a CVS secure system that's double password protected, and it's all in compliance with HIPAA regulations. All our calls are recorded and monitored for customer satisfaction and to ensure HIPAA regulation. We have 24/7 phone number for patients and caregivers to call back, and RPH can answer all their questions. I will talk about my personal experience. I had COVID earlier last year, and I recovered from COVID in 1 week, and I took 5 days of work, but I had this terrible cough for 3 weeks post-COVID infection. And I was able to work remotely while being recovered from cough. But if I had to go on site, I would take 4 weeks instead of just 1 week off. I also had a surgery in April 2022, and I took 2 weeks of work instead of 6 weeks without getting any state disability benefit. So I was able to recover while working remotely and still taking care of my patients. I mean, as been said before, there is less distractions at home, less interruptions from staff meetings and phone calls or other daily activities. I still give and provide more engaged patient consultation, and I use all my online resources like Facts and Comparison, Clinical Pharmacology, and Lexicom to answer my patients or caregivers' questions about anything. And as I said earlier before in the meeting, with the technology and we were able to send messages to patients and caregivers now with links from manufacturers to show product administration while explaining it to them. I actually feel it improved the communication because we have now more direct and focused communication rather than in-person communication. And I believe it reduced errors because we have a custom and more comfortable work environment. So we have better chance to perform data verification, review orders, clinical interventions, and all these MDO phone calls to get clarifications. And as said earlier before as well, it improved flexibility. So it's better to accommodate for last minute shift changes without much advance notice and to cover for emergencies. And I actually believe that it's better to implement this in California. If it's already implemented in other states, I mean California being one of the top states for traffic congestion and pollution. So that will be better to have something like this here because it will affect public health and safety. I mean, it will provide better work balance, as it's been said before as well. We will avoid daily traffic and accidents. And I guess with the public health benefits, we will have lower risk of depression and other chronic diseases. So, and I believe we will have less employment rate as well, unemployment rate, and other economic benefits like money saving, especially with the gas prices going up, right? With all the gas pricing rising and stuff like that. So I truly believe that it has all the benefits, and we can implement laws to make this happen as permanent. And thank you so much for listening.
The comments.
This is the moderator. If I can please have only submit one comment for one request for public comment. There is quite a few on the list, so it might take some time to get to you, but that way we can keep the Q&A queue in order. So the next individual is Annie Kim. After that is calling user 27, and then Eileen Masilda, Mark Johnson, Mohammed Mosiet, Rita Maria, Tina, and Vipul Patel, Stephen Gray, Maria Lopez. So if you please can be patient, and I apologize, Anthony Lee, Lindsay Gullahorn, Jassy Grewal. If you can please be patient, no need to submit additional requests. We will get to you, but we are trying to go in order here. So Annie Kim, I'm going to send a request to mute your microphone.
Pharmacy. Can you hear me okay?
Yes.
Okay. My name is Annie Kim, and I'm a California licensed pharmacist. I wanted to let you know that I do work for CVS Specialty, and I'm what is called a front-end pharmacist. So I provide consults, obtain necessary documentation on prescriptions, clarify and review them prior to dispensing. I'm not involved in RX packaging or fulfillment. I believe specialty medications do require more clinical interventions, and patients need us to thoroughly counsel them. I am able to do that from home and take my time with them without having any distractions. Regarding patient safety, I know some of you had concerns. I wanted to kind of describe my work area. So I have two big monitors where I can more easily look at charts and zoom in on prescriptions and have multiple sources open. So it gives me actually more access than I would at retail where I used to work. We are also required to be hardwired to our connection, no Wi-Fi's, and I don't have a laptop. It is a desktop, so we cannot leave our work location. With that said, I have plenty of space to work, and everything is electronic. We don't take prescriptions by hand. We don't do anything. And of course, we're connected to a secure network. There was also times where I was in retail and HIPAA was an issue, whether it's people standing too closely, crowds, or even people speaking too loudly, whether it's an older patient that has a hearing issue and we have to raise our voices, or others that just complain that, it was too loud and people could overhear. I don't have that issue at home at all. Instead, it's quiet here and I can just focus solely on my patients, whether it's a 5-minute conversation or a 20-minute conversation. And I think customers or patients are more comfortable also because they're calling from their home. They're not sitting in a pharmacy where they have a million distractions and others around. So it does go both ways, and I do believe patients appreciate that, from being able to do things from their own home as well. And I did want to tell you about a personal experience of mine. My toddler was injured at daycare. Severely. She was hit in the face with a tire swing. I was a new mom at the time, so of course I'm panicking, and I had to sit in traffic for about 45 minutes to an hour to get to her. I mean, I was experiencing so much anxiety and stress. It was overwhelming. So when I had the opportunity to find a work from home job, I took it without a doubt. And I even took a huge pay cut because to me, as a working mom, that really mattered. That it was only 10 minutes away from my kids in case there's any emergency. So I hope you guys can understand how this is important for some of us. Even if you're not a work from home parent, I'm sure there's someone that you care about that you would love to be able to get to in case of an emergency. If pharmacists are required to return to work, I think many of us would lose our jobs. Some of us have taken positions remotely that are very far from the pharmacy. Others have relocated or sold their cars. If this waiver is not made permanent, it would disrupt many lives, families, and even the job market. I think it would definitely cause more traffic and pollution, like others have said. And my final thought is technology has really allowed us to progress in the field of pharmacy. So please let us embrace it and move forward and not backwards. I understand there's concerns, but those can be addressed along the way to help improve technology or help better the field of pharmacy. Thank you for your time.
Thank you for the comments.
Next individual, call-in user 27. I just sent a request to unmute your microphone.
Hi, good afternoon. This is Jantin Yefterenay. Just want to make sure everyone can hear me okay?
Yes, we can.
Thank you all for your time, and I'd like to commend everyone for their thoughtful and well-said comments. I think it is important that we identify our fields of practice and in what gravity we're connecting with the patients. I think it's important that if someone is in an adherence level or if it's an inpatient, outpatient, there is distinctions that I think are important to make. My background is that I'm currently a community pharmacist and I'm the PIC of that pharmacist. Prior to that, I was an MTM pharmacist working from home. And throughout my duration as a community pharmacist, I had also worked as an MTM pharmacist on site making phone calls. So I see the importance of the ability to create phone consultations or video consultations with patients, especially with patients who have specialty meds who they will require a 30-minute consultation. But I think there is some concern about certain physical aspects of one pharmacy versus another. And if it's a community setting, as opposed to an inpatient setting where I'm in charge of one other pharmacist. But if I had other pharmacists doing remote order entry or remote verification, it would raise some concern for me of who is in my pharmacy at that day, how much advance notice I'd be given. So while I applaud everyone's comments, I think we should maybe proceed with caution about practice settings and how we implement this. Thanks for your time.
Thank you for the comments.
Individual, Eileen Masilka. I'm going to send a request to unmute your microphone.
Hi, are you able to hear me?
Yes, we can.
All right, thank you. Hi, again, my name's Eileen Masigla. I am a full-time front-end specialty pharmacist along with Annie Kim, and I also do work in the inpatient setting. I can say that since we have worked from home, when I was hired, I did a little bit of both. I was trained on site, and after that, I was sent to work from home, and I can say there is a drastic difference. Definitely the energy level is different, and the preparation and the driving, it really makes an impact on our overall preparedness and even job performance in the work setting when we are at work. Since we have worked at home, I can say that we have been able to continue the Board of Pharmacy's mission and vision to protect, promote, and even enhance the health and safety of Californians by evidence of we do have a great reduction in medication errors and also improved attendance. And this is by evidence of speaking with upper management. We do have that documentation if needed. And to touch on prior pharmacists have commented earlier, I have observed continued infection control. I have an example. I have an on-site colleague. He was sick with COVID. He was out for a week, and should we all have been required to be on site, he very well could have taken out our entire department in a sense. So luckily, were no other pharmacists or technicians who fell sick. I have not been sick at all since working from home. So I think that's a good benefit to have. And previously, we have been able to expand. We have even acquired a federal employment program specialty. We've been able to expand our personnel beyond the confines of our previous call center. This has given more visibility for our clients in need with more pharmacist availability. And for us, if we were required to return on site, for us, we are CVS Specialty Pharmacy in Redlands. There currently is not enough space to accommodate all of us. We are over 30 desks short, and our workspace was already tight prior to expansion. Sharing cubicles would result in very unhygienic environment by shared airspace, and on top of that, there would be noise pollution and potential HIPAA violation, if you will, if we're already speaking with the raised voice, and then we have a pharmacist or another colleague who is sitting very closely to us who also has to speak clearly to maintain a conversation with our clients. If we were to potentially lose 30 or more employees, our productivity and workflow would drastically decline and would cause a major disruption on patient care on multiple levels. I would say that also, just being in California, an eliminated commute would promote employee safety and maximize patient care thereon. I mean, though some may live nearby, most of us do require use of a highway to get to work, and driving anywhere in California, highway, street, what have you. I mean, it's dangerous. We're heavily populated, we're heavy congestion. There are statistics from the California Highway Patrol that do indicate that injury crashes occur the most between the hours of 7 to 10 a.m. and then 3 to 6 p.m. And these crashes occur in thousands versus maybe hundreds versus other time of the day. I would say potentially for all of us, our assigned work times require us to drive within both of those time slots. And if I'm to further, for us with our setting in Redlands, more specific to our work site, San Bernardino County, where Redlands is, it does have the worst air quality in the state of California per the American Lung Association. Adding hundreds of cars of just us alone to the air would probably worsen that statistic and potentially worsen health for those who already reside there. For our specialty setting, being in office would not provide any additional benefit to our job functions. My own and my colleagues, we have a job description that does not include a dispensing role. If we were required to return on site, we would be performing the exact same function, essentially in a small box, a small building. I also, though I work specialty, I also work inpatient, and I work with other healthcare personnel, more specifically physicians and other prescribers who also work from home. And with that said,
10 seconds.
I don't see. Oh, I'm sorry. In conclusion, I would say this is my third year in the work setting, and are my 10 seconds up? I do enjoy what I do, and I would really like to continue to work.
Thank you for the comment.
Mark Johnson, I'm going to send a request to unmute your microphone.
Hello, board. This is Mark Johnson from CVS Health. I must apologize. I'm one of the people who submitted multiple requests as I switched to my phone from my computer. I apologize for that. 25 states have permanent allowances for pharmacy technicians to work remotely. Nearly all states allow pharmacists to work remotely. This is not a new practice realized by the needs of the pandemic. This is an industry standard across America. And we have all heard comments today that believe that this allowance, at least in part, existed in California for decades. In addition to the benefits that Jesse aptly listed, studies prove that distractions increase the probability of errors. Remote work occurs relatively free of distraction and thus increases public safety. Additionally, it is impossible to divert controlled substances when working remotely, which again increases public safety. As work exits the pharmacy, staff spends more time on patient services, which again increases public safety. Other states recognize remote work without the need to overregulate, as some of the groundbreaking states originally did, as many of the what-ifs discussed today have not come to fruition or were deemed insignificant compared to the overwhelming benefits to public safety that remote work brings. This is simply not a matter of convenience. Additionally, the DEA allows for remote work involving controlled substances. Bear with me for 1 sec. I have. Thank you. The definition of pharmacist explained within the remote waiver in California appears to require that each individual statute and rule require the remote work to be listed individually. However, the waiver focuses on electronic access to pharmacy systems. If this definition does not allow a pharmacist to practice remotely outside of a pharmacy without required additional regulation, then the entire practice of pharmacy cannot be performed outside of a pharmacy. This means that advanced practice pharmacists prescribing, counseling, activities allowed pursuant to a CPA, pharmacist immunization, and the many clinical activities that occur today are not covered by the current waiver and thus are arguably illegal today. Therefore, the board has not provided this level of clarity of enforcement discretion that they have allowed with this waiver. Additionally, the board's focus on data entry allowances within 4071 is puzzling. 4071's intent was to allow for order entry at the point of prescribing, and not necessarily once a prescription was received at a pharmacy. Even if 4071 could be interpreted to allow a pharmacy to conduct data entry remotely, we know that data entry is allowed by non-licensed personnel in California, rendering pharmacist data entry practically useless. Pharmacists verify data entry usually when they are performing DUR. They don't perform data entry. The waiver has arguably ended most forms of clinical pharmacy practice already, but will certainly have devastating results on public safety once the waiver expires. CVS Health suggests that the board declare that the definition of pharmacy allows for the practice of pharmacy, both within and without a pharmacy, without the need for additional regulation. If the board feels that a statutory change is required, we suggest striking the phrase "as authorized by this chapter" that Eileen read earlier today within the definition of pharmacist only, and that the board concentrate their efforts on allowing technicians and unlicensed personnel to work remotely. Remember, the board's 2022 legislative effort failed, so a decision involving anything more than...
Microphone has been muted. Time's up.
Thank you for the comment.
Next individual identified as Rita Maria. Rita, I'm going to send a request to unmute your microphone.
Board members, thank you for your time and for the opportunity to comment on this topic. I'm from Cedars-Sinai Health System. I would like the board to consider the positive impact remote processing plays, specifically in an acute care hospital inpatient setting, which is different from a retail setting. As others have mentioned earlier, remote processing has been found to be a safe and effective way to provide pharmacy services in a hospital setting and really enhance patient care. It has also been a critical strategy for hospital pharmacies to provide care during times of high patient census, of course, and during the pandemic, and has allowed us to provide remote patient monitoring to also help reduce hospital readmissions. I would like to note that controlled substances should not be excluded from remote processing, since these medications are needed for inpatients who are, of course, under the care and supervision of the providers, and these medications are administered by a registered nurse or a licensed independent practitioner. Additionally, health systems also have diversion prevention, safety, and privacy strategies in place to monitor remote processing activities. So we would really appreciate your consideration for making remote processing permanent after the waiver expires. Thank you.
Thank you for the comments.
Next individual identified as Tina. Tina, I'm going to send a request to unmute your microphone.
Hello, everybody. My name is Tina Patel, and I'm a licensed pharmacist in California. I joined the specialty pharmacy setting. I switched from a full-time retail big position in 2021, and I joined a team based in SoCal, while I live all the way in NorCal. So I was able to take up this exciting opportunity only because it was a fully remote position. And this enabled me to expand my scope of practice. So just to describe, I had my previous colleagues from CVS Specialty describe the job we do. So I work as a front-end pharmacist. And as detailed earlier, we have a separate designated area. That was one of the concerns, which was discussed earlier. And we work on a secure computer. There's no Wi-Fi, there's no printer, there's no paper or pen involved. We do take orders, but they're all in the computer, which is secured. And that has been a priority since we have started. And this was also discussed about overwork earlier, I heard. So I would really like to mention we get to take our scheduled 15-minute breaks and our lunches, which has been a very refreshing break as compared to my previous work setting. And just touching on the previous discussion the panel had, on those 4 or 5 points earlier. So the front end, which is data verification or, talking to patients, and the job of the dispensing pharmacist, which is the back end, it has been demarcated and separated even in community pharmacy. So that is not only, limited to, for example, specialty pharmacy. So, and other than that, you also discussed some disciplinary actions. So, bad actors, theft and diversion, we know in retail or community setting has been, an issue. So I think it's unfair to, singling out remote setting or work from home settings for disciplinary actions because they exist, unfortunately, everywhere. So, and also, earlier the panel was discussing that we are not expert on technology. And we are all using it, or we have been, ending up to use it. The pandemic has brought us here, but I think that we should use it as a chance to, build upon the work from home setting, rather than be scared of the technological advances or not knowing is this safe or not. Because of course, all the other fields are using it, and I think pharmacy field should not be left behind. So the pandemic has helped us to set up a platform, have a trained workflow, workforce, and have processes which would really help us in future public health emergencies, or as we keep talking, a big one may come, or any other natural disaster, or we have fires, we have rains, we get all these meetings from so remote processing, work from, we have a workforce, we have this set up. It will be very unfortunate if we scrap this and not use it for future, just because we don't know about it or we are not comfortable if it is working. So I just wanted to take this opportunity to describe, the fears, or, you were thinking that this is not safe, or, we are working from Starbucks. So that is not the case. So we are working in a very secure and trying to do our utmost. And this actually gives us the opportunity, as I can really compare it from a retail or community setting. The patient care in this focused, distraction-free environment is much higher. I have more resources online, I have more time, and I have more access. Patients have more access to pharmacists. I'm in the the California time zone, and I could have East Coast patients calling me at 10 o'clock at their time, and we are helping them. We are saving them not going to have an ER visit just because we are here and we can work from home and give that opportunity. So, patients are thankful for this, for these timely, in-depth consultations we can provide, which was not possible in the retail setting, the long consultations. And I feel it is very important that to pharmacy to grow as a profession.
10 seconds.
That we are able to provide pharmacists different flexible work settings, and work from home remote setting is one of them. So please, let's build on it rather than scrap it.
Thank you for the comments.
Next individual, Jassy Grewal, I'm going to send a request to unmute a microphone.
Hello, this is Jassy Graywall with UFCW Western States Council, who mainly represents pharmacists and pharmacy technicians in the chain retail setting. We just want to express our strong opposition to moving forward with the remote processing proposal that would allow for remote processing from an unlicensed facility or someone's home or a place that is not regulated by the board. We have similar concerns to that stated of the board members, so we won't go into them, but just want to make a note that this was an extraordinary measure that was passed during an extraordinary time, which was a COVID-19 pandemic. The board and DCA acted rapidly with the waiver response, which we feel like is a necessary tool that they can use in a future pandemic if deemed necessary to be able to have remote processing happen. We have concerns around HIPAA violations, potential security concerns around laptops, and folks that might come into contact with sensitive patient information. So just wanted to express our strong opposition to the proposal. Thank you.
Thank you for the comments.
Next individual identified as Maria Love. I'm going to send a request.
Hi, I just wanted to echo the recommendation to extend the waiver. I believe technology advances should be taken into consideration. We have Silicon Valley here in California, where world leaders in technology exist, and the practice of pharmacy should meet those technological advances, and particularly meet industry standard for remote work. I am not an IT expert, but my understanding is that the specialized teams that pharmacies hire and medical settings, because I am aware of medical settings with pharmacists that are working remotely, handle the firewalls for remote workers in these many settings. And earlier we heard about PrEP and some of the functions for HIV counseling that were completed remotely that I talked about in the paper. And I'm just thinking about PrEP and how pharmacists in PrEP could help remotely for patients with different languages, like a Spanish-speaking pharmacist who may not be in the pharmacy, but the pharmacy could call in a Spanish-speaking pharmacist to help a patient. So I just think that my hope is that this could be extended and that more information is obtained so that the board can help pharmacy meet the standards in the industry. Thank you.
Thank you for the comments.
Next individual, Lindsay Gulahorn. Going to send a request to mute your microphone.
Hi again, Lindsay Gulahorn with the California Retailers Association and National Association of Chain Drugstores. I think a lot of what I was going to say has already been said, but I do want to be on the record that we are very supportive of the board taking action to ensure remote processing can continue beyond the expiration of the waiver. Thank the board for the waiver and for extending it through May, but we do believe there is a need for permanent remote processing authority. Although COVID has brought the benefits of remote work to light, as has been noted, remote processing has been practiced in California long prior to the pandemic. As one of my colleagues stated, the overwhelming majority of states in the United States allow pharmacist remote work, and I think over half or nearly half allow remote technician work. There's a lot of associated benefits that have been demonstrated with the allowance for remote work, greater flexibility for pharmacists who can balance work and home life more easily, less distractions, which also allows for greater focus on work and reduced errors. So we really do think remote processing helps with the workforce pressure in pharmacies. And also there are systems and processes in place to safeguard patient privacy. I know there was broad interpretation of existing law before that remote processing was not prohibited based on the definition of pharmacist in the Business and Professions Code. And I understand today that that is not the board's interpretation. So for this reason, we are, again, very supportive of the board taking the necessary steps to ensure that all types of remote work can continue for all pharmacy settings, including community pharmacies. We don't want to see this just limited to inpatient, just because community pharmacies comprise such a significant percentage of California's pharmacy sector. And last thing I want to raise, just in terms of the benefits that we've seen here, I would like to agree with Mark Johnston. A big benefit, again, is a reduction of errors because of the reduced distractions in a remote work environment. Errors often occur as the result of a distraction. Distractions are eliminated when work is taken out of the pharmacy and takes place in an office-type environment. It's also impossible for a person working remotely to divert drugs. As another commenter mentioned, another benefit that has been put to use is the ability for pharmacists to perform prescription verification and assist with medication adherence remotely. This has been helpful during disasters, where pharmacists working remotely can help patients get their medications at central fill locations, for example. And by allowing these tasks to be performed remotely, pharmacists working in the stores can better focus on caring for patients. So again, appreciate today's discussion, but would urge the board not to narrow this proposal too significantly. We do think pharmacy technicians should be included. Understand that that's not on the table today. So if this is limited to pharmacists, just want to ensure that pharmacists working remotely can continue to do so, continue to perform non-dispensing functions that are meaningful to patients and assist in reducing pressure in the pharmacy. Thank you.
Thank you for the comments.
Identified as Stephen Gray. Stephen, I just sent a request to unmute your microphone. And lastly, we have Mohammed Musiad. We will proceed with you next.
Thank you very much. I'd like to focus, I agree with a lot of the stuff that has been said, especially about continuing the ability for remote work in various forms from various locations. I'd like to focus my comments on a couple of concerns. There was a concern, I believe, by Board Member Chandler about privacy. It's interesting that the privacy laws in California under CalMIA, the California Medical Information Act, also apply to pharmacies and pharmacists and all licensed professionals, including licensed pharmacy technicians. So they are already under a legal and a ethical obligation to protect the privacy of patients and the confidentiality of communications. Also under the privacy provisions of HIPAA, they are also considered covered entities, whether you're a healthcare professional or whether you're a pharmacy. And you're also subject to that federal law, which has huge penalties and implications if those are violated. It's quite common for physicians, nurse practitioners, PAs, even advanced practice nurses and others to work remotely, even certified nurse midwives, and they are working from unlicensed places, sometimes even working from their cars or vehicles. And they are not licensed places, but they also have these obligations for privacy and for security of information. There's no reason to separate out pharmacists as being less trustworthy in meeting those obligations. And I'd like the board to consider that and also consider it, as Dr. Yoshi Keith said, we've been doing this for over 30 years. And in fact, when we opened at Kaiser Permanente the call centers, the board executive officers, chief inspectors, and even board members visited those facilities and gave their approval, and partly because of what it did was decrease errors. And errors by removing that work from the pharmacies, including at that time the taking of oral prescriptions, was a great benefit to patient safety as well as work-life balance. workload balance by having a pharmacy that has people on staff that can go into another pharmacy or hospital and work was very important too. So there are plenty of benefits from allowing. There may be certain things that the board is unaware of. Some of the technology. You've heard about how you can remotely look in a vial and see what's in there. Those are 3D color images in some systems. They even have chemical sniffers that sniff what's in the vial to make sure it's the right thing. And even lasers shooting through the amber vial to make sure that the electronic image of what's in there is valid. So there's a lot of ways that depending on what you're going after in the prescription filling process that could be done remotely. It needs to be carefully considered, but it certainly can be done well and better. I mean, we're talking about reducing in one system that I've mentioned before, one error out of every 40,000 prescriptions to one error out of every 44 million prescriptions. And since then, it's even gone past then. There are literally hundreds of thousands of prescriptions that are filled and entered remotely. And the key word is enter. 4071 says that nothing that's entered into the pharmacy system, 4071.1, can be dispensed until a pharmacist approves it. And it's really that process. It's the pharmacist at the site. What it does do, it cuts down errors in transcription, which is what it was all about when that statute was introduced and processed through by Kaiser Permanente. It allows prescribers with permission, not without permission, to enter things directly in, and it has reduced transcription errors and so forth. And those prescribers, by the way, are now over 2,000 or 3,000 pharmacists that have that ability as prescribers in a system that is an integrated system who have access to the medical record from these remote locations, which have far more sensitive information than the pharmacy systems, to also enter that information to do the DUR and to make sure that they are legitimate prescriptions. So I would encourage you to really be very careful how you place limits around this, because it's been working very well for tens of millions of prescriptions every year in the state of California.
10 seconds.
30 years. Thank you.
Thank you for the comments. Go ahead, Elizabeth.
Sorry for interrupting you there. Actually, I missed one person before Mohammed is Anthony Lay. We're going to send a request to unmute your microphone, Anthony.
Hello, can you guys hear me?
Yes.
Yes, we can.
Perfect, thank you. Hello, President O, Pharmacy Board panel and participants. My name is Anthony Lee. I've been a California pharmacist for 2 decades, and I truly am amazed at how pharmacy has evolved. And I know that it's amazing that my career over the course of 2 decades that I've seen my role has changed so much. I've seen from becoming a traditional pharmacist to actually becoming a healthcare professional, and so which is kind of nice. I just want to mention some key points that's already mentioned. I just want to give it some reinforcements to it. We did talk about some scenarios about the privacy information is being breached. Definitely, I think that's a concern. Privacy information is very, very important. We definitely want to protect that for patients' rights and things like that. And we did mention about the scenario of the laptops at a Starbucks. That is, of course, the extreme case of it. And that's why I think, when I took onto this position a year ago, I noticed that the company that I work for, they have cutting edge computer systems. They use computer systems that constantly upgrade softwares to avoid malicious breach of private data, definitely. And so, and then also laptop wise, for me personally, I'm actually only allowed to use computer devices. And so sponsored by the company. So I don't use Wi-Fi. Definitely, my computer system is hardwired, with firewall and things like that. So if company really provides their own laptop and their computer system, I think that at least prevents from personal computers being used for work. Privacy information is always going to be an issue. I mean, we're not the only company or the profession that are worried about privacy information being breached. Banks, cell phone couriers, they all are afraid of, informations of their clients being taken away. And that's how we have IT departments. I don't know specifics of how these security thing works, but we have IT departments that constantly look into that and obviously work with us so we can actually protect patients' privacy information, that's for sure. Another thing that I want to mention is during the early pandemics, I was actually a PIC at a high volume store. I'm actually at a retail, and my wife had COVID. And so I was worried because, I don't want COVID, and I sure run a busy store, and I do not want to get that to my patients nor my colleagues. And so I really extremely followed the COVID protocol. And luckily, I continued to work without any issues, but it was a lot of horrendous nightmares of worry and things like that for me. And so now, knowing that I'm working remote, I noticed that working from home has really given me the ability to provide like higher productivity due to less downtime from sickness, and more importantly, less likely to spread the sickness to others. And that's one thing I noticed now. Disability that we mentioned earlier before, yes, some of our colleagues have some disabilities, and I think this opened up an opportunity for them. I can't speak for them, but I can speak for myself that I don't have any disability, but however, I do have severe allergies, and there are days where I have really bad allergies where I cannot work in the office, but working from home really has allowed me to be with my computer, even if I can make it in the office. So my productivity is still there, which is kind of nice about that. Patient counseling, I noticed another thing too, that when I did counseling at the retail side, I felt that I got to be more careful, more alert. Even patients don't feel comfortable telling their personal stories because they know that, the other people around them, even though they're already within their distance or whatnot, with working from home, patients are really confiding their information with you on the phone. What more comfort can you get with discussing your personal issues right at home that nobody's around you? So which is kind of nice for them. And work-life balance, definitely, I think that's important. I commute back and forth to my retail at one point. Even if I were to commute to my facility with this new job, it would be like an hour and a half, and that was definitely waste a lot of drive time, and that puts a lot of stress on me. And I felt like, with this, it definitely helped me with less stress on that, and more work, to focus and less error. And so, in general, that this is a good.
Line was muted. Time was up. Next individual identified as Mohammed Masya. Sent a request to unmute your microphone.
Hear me?
Yes, we can hear you.
All right, great. Thank you. A lot's been said already, so I just want to focus on a couple of the points that were brought up from the questions. My perspective is from home infusion specialty pharmacy. So, when we get our orders, or everything we get essentially is from eFax or from electronic prescription, we never really see paper anymore. That's just not really a part of what we do. We don't have paper charts. These are the kinds of things that we can do with the technology that we already have, and we've been doing it for years. And so there's really no risk of, anything like paperwork or anything like that from a remote location, because that's not something we're already using. Another point I wanted to make was that our workflow that we already have been using for years and years and years consists of clinical teams and production team. And so the clinical teams are the ones that, work with patients. They're the ones that discuss everything, get all the orders, put everything in, get everything processed, do all the analysis and everything. And then the production team are the ones that are actually collecting the paperwork, getting everything dispensed, and getting everything filled, and getting everything shipped out. This is actually no different in the office or at home. So there's no distinction if there's a problem with, if the board finds a problem with, who's responsible. I mean, this is something that's already done, and we're not the only ones who are doing it this way. The next thing I wanted to mention was the security. It's a gold standard, an encrypted device using multi-factor authentication and a VPN via a VPN. This is something that's used everywhere, and it's like I said, it's a gold standard of security. It's something that we use in our devices, and it's also the things that our home health nurses use when they go out to the patients, because they're not carrying around charts either or paperwork. They're carrying around their devices that are also secured the same way. And I think that's about all my points. Thank you so much.
This is the moderator. No additional requests have been submitted. Would you like me to close the Q&A?
Yes, please. Thank you. Is that it? Are we through? All right. Okay, so obviously we understand there's a huge interest and challenges with it. So we understand. We don't take this lightly. So thank you for all the comments. We'll move on to the next questions. So the next question, it's number 3 in the meeting materials, but
could we take a break?
yeah, probably a good idea. Let's take a quick break. Let's take a 10-minute break. We'll come back at 2:40. We'll get right back on it. Just for I think we'll probably close the meeting around 4 o'clock for the sake of time and being respectful of everyone. Just in warning everyone, we may not be able to go through all the questions. All right, so moving to the next part, should the pharmacist in charge be required to authorize or decline use of remote functions for the pharmacy? Should the pharmacist in charge be required to declare that remote processing functions are necessary and advisable for the pharmacy's practice prior to their use? I personally think that pharmacies in charge have to have the authority to determine the remote processing authority and also functions under what conditions such remote processing may occur within the confines of the law. So with that, I will say, Jessie.
Absolutely agree with that. I think ultimately, if the pharmacist in charge is going to be responsible for anything that is dispensed from that pharmacy, even if it's remotely verified, that they should have autonomy to decide what functions are performed, who's performing them. And actually, maybe this is a question for Anne or Eileen, but I'm kind of curious as to whether this issue has even come up since the waiver has existed. And I don't know if that's something that they can even tell us, but I'm just curious, under the waiver as it exists, is the PIC being held liable for remote work?
Jessie, I'm not quite sure that I can totally answer that question. I would have to go back and look at some of the investigations. I apologize.
No problem. I was just curious.
Okay. And any other thoughts? We'll move on to the next question. Can a subsequent pharmacist in charge make a contrary determination? Obviously, I agree. I think that this could be a challenging dynamic for some pharmacists employed at the pharmacy, but PIC really needs to have the decision-making abilities. I would really hope that where we are focusing on as a board is empowering pharmacists in charge really to have the autonomy and authority to make decisions that would work for that pharmacy. With that, any thoughts? Nope. Okay. All right. Moving on to the next question. Should pharmacy staff members be required to consent to performing remote functions? Again, whatever way we go, obviously this is a concerning matter. I think that work surveillance also is very concerning, but we probably, because of the guardrails we need to put up, we'll have to have some sort of consent for pharmacy employees to consent doing this. I would imagine a lot of folks would be totally fine with doing this from what I'm hearing from the public comments. So I would think that this is an area that is probably agreeable. Any other comments?
I would just say my comment on this would be kind of going back to the comments I made earlier, just about security and safety and all that stuff, that consent to performing remote functions would also require a strict set of data protection, HIPAA, reinstatement, all that stuff. So I don't think for this policy question, it wouldn't just be a consent to perform functions remotely, but all of the requirements in addition that would make that possible, including safety, privacy, confidentiality, HIPAA, all of that stuff. So that's the only thing I would have to add on this one.
Thank you, Trevor. All right, next question. Should remote order entry and remote processing functions be authorized only for California licensed pharmacists in connection with California licensed pharmacies as per the waiver? Should it be limited to pharmacy staff also located in California? Should it apply outside of California, or should it be left to the states in which out-of-state pharmacies and pharmacy staff are located to decide whether or under what conditions remote order entry, remote order processing will be permitted? Should California law specify that non-resident pharmacies must be guided by home state law as well? I feel strongly that it has to be limited to California licensed pharmacists and working in California for a California licensed pharmacy. Again, California licensed pharmacists working in California for a California licensed pharmacy. I would feel comfortable. Any other thoughts?
I agree with you, Sung. And if I'm not mistaken, I think that's how the majority of remote working states work anyway, that you do have to be licensed for the state that you're verifying in.
Right. All right. Next, we're moving on pretty quickly on these things. If it is not so limited, is there any perceived risk if these remote order entry, remote processing functions are permitted in out-of-state or even out-of-country locations? Well, I think we are probably keeping it within not outside of California and within California. So, all right. With that, taking a pause here for public comment. Just please a reminder, we appreciate all the stakeholders to speak. But please, for the sake of time, if you could please focus on the questions that we just covered and also only add pertinent new information that was not covered by your previous public comment. Please just be mindful of the time. Thank you so much. Moderator?
This is the moderator. The Q&A is now open. The instructions are on the screen. Press question mark, type comment in the text field, send it to all panelists. For those calling in, press *3 to raise your virtual hand. We do have an individual identified as Stephen Gray and Keith Yoshizuka. Chairperson, can I confirm, is that 5 minutes again?
Sure.
Okay. Stephen Gray, I'm going to send a request to unmute your microphone in just a moment.
Thank you very much. I'll keep this brief. I want to speak to, just for information purposes for the board, when the federal government under CMS, Center for Medicaid and Medicare Services, required that all hospital orders needed to be reviewed by a pharmacist unless they were an emergency order before they were administered to the patient. And then subsequently, the Joint Commission made that part of the requirements for accreditation. That applied nationwide, and there were problems in many states having the capability of pharmacists there to do that. And there are, at that time, and I believe they are still in operation, there are pharmacists who are licensed in California, working in California, who are reviewing hospital orders for hospitals outside of California. And in one case, I know that the only requirement of the other state was that they be in a facility licensed by California. So I just wanted to let you know that, again, there may be some more information searching before you decide whether, that's okay or not. And then the other thing, there should be some discussion by the president and by Board Member Crowley as to why they believe that it should only be done and the reasons for it only be done by pharmacists working inside California and or licensed by California. I think that's going to be very important going forward to be ready to answer those questions, whether it be from an interstate commerce point of view or just, whether, that would engender some retaliation, if you will, for those that might be being done by outside call centers and so forth at this time. And I don't know if there are any. So with that in mind, I just wanted to share that information. Thank you.
Thank you for the comments, Dr. Gray.
Thank you. Next individual, Keith Yoshizuka. I'm going to send a request to unmute your microphone in just a moment. Request has been sent.
Thank you for the opportunity. And similar to Dr. Gray, I will use the example that I used to use in the classroom. Some of our more rural hospitals, critical accident, very small hospitals, I'll use the example of Truckee, California. For those of you that are unaware, Truckee, California is along Highway 80, close to the Oregon border. The nearest large city where they would have specialists is Reno, Nevada, which is about 15, 20 minutes away. Several of the people that work at the medical center in Truckee commute in from Reno, Nevada. So, I'm not necessarily opposed to requiring licensure because the pharmacists there are already licensed, but I would be hesitant to require that the individual has to be in California because that kind of negates the advantage of being able to doing the remote work, particularly for our small towns that are close to the border. Thank you.
Thank you for the comments.
No additional requests have been submitted. Would you like me to close the Q&A?
Yes, please. Thank you. All right, moving next to the next question. Should there be any brick and mortar requirements for remote order entry, remote processing authority? For instance, should these remote functions be allowed at home sites or other sites not licensed by the board? Should they only be permitted at call centers that are licensed by the board for this purposes, or are at least registered with the board for tracking purposes? Obviously, this question is tough. I think for me, I from where we are among the stakeholders, I think that there has to be some balance of allowing beyond brick and mortar, but obviously this is already an allowed practice in some sense. So we'll have to figure out where we want to go for this part. Members, any preference or thoughts?
No, I think this is a complicated issue that we've kind of touched upon, and we've gotten a lot of feedback from how it varies for different settings. I also think there would be a big difference between a pharmacist who's at home verifying strictly electronic and has no paper PHI or protected health information versus a pharmacy that does actually have some patient health information that I would be hesitant to allow outside of a brick and mortar licensed facility. But I think we'll just have to continue discussing this as we go through the process and figure everything out.
Right. Any other thoughts? All right, we'll move on to the next question. If remote functions are permitted in home or unlicensed sites, should the law specify that those locations are subject to board inspection? Would this provoke potential legal challenges? So I hope that this is not so controversial, but I believe if we are allowing someone to work from home, that there has to be an authority for inspectors to be able to go into there and to be able to inspect. So I think that that has to be a compromise that they're willing to make. And the process and the systems that are set up, I think that once the systems get so complicated, there is a lot of opportunity for unfortunate bad players to circumvent the rules and regulations as well as inspecting authorities. And I think this would get very complicated if we don't have a way for someone to inspect a location where they're working. So I think the least I would maybe a registration requirement of some sort, but again, this might get very complicated. So with that, Jesse?
Yeah, I think this will get tricky, and I think it would probably prove difficult for the board to actually manage. So I would be curious to hear, I guess, the staff's perspective on that. I mean, if you think about all of the hundreds to thousands of pharmacists who could potentially be working from home, that would just overwhelm the inspectors, I imagine, to have to go in to potentially inspect all of those places.
Right. Trevor?
Just kind of tagging along on that, I would just be interested in if we could get the expertise of our inspectors to say, like, just run this scenario by them and tell, and because it's not my expertise, but I think they would be able to tell us, okay, in this scenario where people are doing this particular task from home, these are the biggest risk factors, and this is what we would typically look for in a pharmacy. I think we should really rely on their expertise as to what should or shouldn't be, or as it escalates up, what is allowed remotely. I think they are the eyes and ears on the ground as far as what they see the most, and we should listen to them and their expertise.
Eileen, did you want to say anything, or Anne, before we move on?
I'm absolutely happy to check in with the supervising inspectors. We've started having preliminary discussions about what this could potentially look like based on, the policy discussions that you all have. We at the staff level do have some concerns with some of the potential just because of the investigations that we have done. That doesn't mean that we don't pursue this type of thing, but I think we need to be mindful of where we are concerned, where we know that there are existing vulnerabilities in what currently exists, and making sure that we are not creating additional ones. So things like ensuring that the PIC is in the decision point, right? I think that, many times in some of the, information that you all receive through the investigation, as the decision maker, sometimes the PIC is not aware that someone has access to the computer, and that's how the billing fraud occurs. So making sure that if we are going to be allowing these, we make sure that we are ensuring that there are systems in place to prevent those kinds of things moving forward. But absolutely happy to continue to work with the supervising inspectors moving forward, as well as our field staff. I would say, specific to the question about inspection, I don't think that we would ever be envisioning inspectors going and doing routine inspections, if you will, at these locations. However, if there was an investigation that required inspection of the location, I would see that would probably be where that authority might be necessary.
Thank you, Anne. Thanks for the comments. All right, any other thoughts before moving on to the next question? All right, so again, should the law specify that a remote site must be located in California? I do think that this is a step-by-step process, so I do think that we need to start in California first. So if remote functions are allowed in home, we're moving on to the next question. So, allowed in homes or other unlicensed sites. Sorry, oops, I'm like losing track of it here. If remote functions are allowed in homes or other unlicensed sites, what should be the record-keeping requirements applicable to the homes or unlicensed sites versus the pharmacy? Well, that's what Jesse was bringing up earlier, and I think it's definitely a challenging question. So there has to be, in my opinion, there has to be a biometrics attached to the individual working, and whatever that means, biometrics, and that would be able to trace to every step of the way of each prescription, each patient, some way to track. And obviously, our waiver kind of sets a good tone, but PIC should have also some responsibility and understand what is exactly going on for the pharmacy that they're performing remote functions for. So with that, any other thoughts? Jesse?
Hey, yeah, I just think kind of what I was saying before. Ideally, if someone is working out of their home, it should be strictly electronic so that there's not the risk of losing PHI, or the issue comes up of how do you transport hard copy PHI to a facility if you're, say, in Northern California, but helping assist remotely for a pharmacy that's located in Southern California and things like that. The other thing too is I do think that there should be some sort of way for the physical pharmacy to be able to have a list or like a report at the end of the day that shows which medications were processed remotely for that day, kind of like an end of day report or end of week report, so that the PIC is also aware of everything that's happening.
Absolutely. All right. With that, next question again, should a law specify that any remote site must be located in California? I do feel that way. I understand the concerns of the rural communities, but unfortunately, I think we're just taking some baby steps here, and I would feel a little bit uncomfortable allowing this to be open to anyone and anywhere. So I would not feel comfortable of supporting anything that's beyond California. Any other thoughts? Okay. Next question, should there be any limit on the number of pharmacies for which any pharmacist can perform functions remotely? Should there be a limit on the number of remote transactions that any pharmacy staff member can perform in a day? Should there be a limit on the geographical distance between the remote site and the pharmacy? Is it acceptable for a pharmacy staff member to work exclusively in a remote location and to never be required to enter the pharmacy premises? Or should there be a requirement of some level of in-person work in a pharmacy to balance remote work and prevent atrophy of skills? There's a lot in this question, but I think that it should just be determined. I don't think that we should set any arbitrary numbers or any distances. I don't think that really is significant. Just tricky, in-person, remote, half and half. I would not be supporting something that requires someone to go in. I think that's just too arbitrary for us. Anyway, that's my thoughts. And I don't know how we would enforce it. Go ahead, Jesse.
Yeah, I agree with you, Sung. I don't think that's really necessary should remote work be made permanent. And I definitely wouldn't want to limit the number of functions that a pharmacy staff member could do either. From one pharmacist to another, what I may be able to safely do in one shift could be vastly different from what another pharmacist next to me. So I would never want to set limits or anything for a pharmacist who's capable of safely providing services. And I don't think it would be necessary in terms of a geographical distance, unless of course we're talking about some means of getting physical records to a location.
Right. All right. Any other comments? All right, moving on. Next, are there any perceived risks or problems with a pharmacy staff member in San Diego remotely processing prescriptions or orders for pharmacy patients located in Eureka? Or with a pharmacy staff member remotely processing above a certain threshold number of prescriptions or orders in a day? What about employees exclusively working remotely and never in a pharmacy? I feel the same way about the question above. I don't think that this should just be decided upon a pharmacist in charge or policies and procedure to make sure that things are done appropriately or correctly. Any other additional comments? Okay, with that, I'll take a little pause and open the line for public comments. Moderator?
This is the moderator. The Q&A is being open. It is now open. The instructions are on the screen for your reference. If you would like to participate, click the question mark inside of the square, type comment, and send to all panelists. If you're calling in, press *3 to raise your virtual hand. So I do have 2 requests. We'll go with Tina first, who raised her hand. Tina, I'll send a request to unmute your microphone.
Hello, this is Tina. As I mentioned earlier, my job location is located in Southern California. I live in Northern California. So I am a licensed California pharmacist. Both the locations are in California. The rules and the laws we have to follow are the same. And I am trained and I keep up with them. And my company helps to keep me trained on those. So the part, we were discussing of having to go in, again, my job functions will not change. If I'm going, my training level, which is maintained by my company, will not change. And I am not in a commutable distance to my pharmacy. And there are a lot of other pharmacists who are in a same position as I am. We would all stand to lose our jobs. So what you decide in February, I have a request. Please do take these things into consideration, to let us know in Feb that, okay, in May, after May, you're not going to have a job. It affects lives, families, pharmacists, our job profiles. And given the current economy and a looming recession, losing our, health benefits, and having to find a new job, there are some pharmacists, I know, their spouses are also losing their jobs right now. So this is just a very difficult situation to put us in. I know colleagues who have health disabilities, are on maternity leave or are pregnant, or, they will stand to lose. So any decision that you take on this, for the long run will have a lot of short-term implications too. And I request the board to please keep all these in mind. Thank you so much.
Thank you for the comments.
Individual identified as Max O. Max O, I'm going to send a request to unmute your microphone.
Hear anything, might not be able to talk, but he did type a question, but that's not the way that we are going to public comments, unfortunately.
I mean that, yes. Max O, I just sent another request to mute your microphone if you wish to give your verbal comments. Okay, moving on to the next individual identified as Stephen Gray. Stephen, I'm going to send a request to unmute your microphone. And then we'll go with call-in user 27.
Thank you again. I agree with the statement made that there shouldn't be any arbitrary distances set. Technology is such that if it works well, whether it's 5 miles or 500 miles. And that's the key. And this is especially important, again, for rural areas, for areas that might be under the management or organizational structure across the state, but not necessarily, down the street or across town from each other. And so I think it's very important to maintain that principle of not having any arbitrary miles or arbitrary hours or anything. I do, however, and you board has heard me comment on this before, there are organizations where their call centers serve multiple pharmacies. So I don't think that's been mentioned yet, but the advantage of those call centers is, one, they can be open more hours, they can serve more pharmacies, they can be more efficient, they can provide specialty teams within the call center to handle hospital, to handle specialty drugs, to handle all kinds of situations. So there's really a value in certain call centers for large organizations to handle. It's not a one-on-one relationship with a particular pharmacy. Having said that, I have mentioned before, there are problems when those organizations don't allow you to talk to a pharmacist at the pharmacy that actually dispensed your medication. And I think that should be one of the things that the committee and the board considers, is that you should allow, at least during ordinary operating hours, for patients to talk to someone at the pharmacy that actually dispensed their medication. Thank you very much.
Thank you for the comments, Dr. Gray.
Next individual, calling user 27, just sent a
Good afternoon, this is Janti Neftat, and I thank you for taking the time to speak about this topic and give me the opportunity to speak. While many have raised the issue regarding working from home allows us in a situation where we're reducing pollution, I think it's also equally as fair to consider that there is a concept where the money that is being made in a particular area is being spent in a particular area. That's important to our economy as well. I think we should also take that into consideration. I don't think it should be the largest consideration, but if we're considering the impact to the economy and pollution, I think there's something to be said about the money that is earned in a particular being used to support that area. Furthermore, it makes the case for providers or pharmacists who are working in a lower income area to come in and be paid less to work in a higher income area, which makes it a difficult situation for people who live and work in that area.
Thank you for the comments.
This is the moderator. Individual identified as Eileen Mislaga. Sorry, I apologize for mispronouncing your last name. I'm going to send a request to unmute your microphone.
Yes, hi, it's Eileen Misigla again. And then thank you for taking in our input. I did want to further, I don't believe an arbitrary distance should have to be mandated. I mean, I work with patients back east, and their quality care is just as good. They know me by name, and we have a very good connection. I also did want to further that should the work from home be taken away as a whole, I will say with our specialty, it does take a lot of time to train us. These medications, they're complicated. They have a lot of parts, and to just find someone who lives down the street from our current call center, yes, it could be done, but I think it's going to have a huge detriment on the population, especially these specialty populations. In my case, we have patients who could bleed. And if we were to start all over with the fresh staff who would be required to drive in and go on site, I would say we're looking into 6 months to a year to fully train and get people up to speed to service our patients. Thank you.
Thank you for the comments.
This is a moderator. No additional requests. Would you like me to close the Q&A?
Yes, please. Thank you, Elizabeth. Thank you for all the comments. Moving right along. So next question, 16. How should a pharmacy be required to track and trace prescription and order processing that is performed remotely or by a mixture of remote and in-pharmacy staff? What kind of digital audit trail demonstrating the contributions of each pharmacy staff member will be maintained? How will the pharmacy ensure that pharmacy staff members are digitally positively identified, verified, and registered with regard to each processing function performed? How will those systems integrate functions performed remotely with those performed in pharmacy? As I indicated in my response to an earlier question, I believe there must be an audit trail, some ways to track each person involved in the step of the way. Could be a fingerprint, could be a facial recognition. I am really intrigued. Obviously there's a lot of ways. So I'm sure there's many ways that stakeholders could demonstrate, but I would say that it has to be identifiable to that person by some sort of biometrics that cannot just be altered or just password driven. It has to be fingerprint, some ways that could identify that individual. So I'll leave it at that. Any other comments? Nope. Okay. All right. Moving along. What sort of requirements should be written into law for ensuring secure transmissions and maintenance of security and privacy of sensitive information? Obviously, the HIPAA security rules may be sufficient to cover the PHIs created and transmitted, but obviously there's also a risk. And staff can consult with experts to confirm that HIPAA security rules would be sufficient. Any other thoughts?
Yeah, I would just agree with that of identifying the best practices that are out there, especially as it relates to HIPAA and medical care, and making sure that not only look for ways we can meet best practices, but ways we can exceed them and really set the standard for the rest of the country when it comes to this sort of thing.
Thank you, Trevor. Okay, moving right along. What sort of records should the board require that pharmacies produce regarding prescription and order processing that is entirely or partially performed remotely? Should the burden be on pharmacies that utilize remote processing functions to provide the board with complete data on the pharmacy staff involved in each transaction? How should that be accomplished? So as I said before, the board has to have access to the records in their entirety to evaluate for compliance with the provisions that would be included in any legislative change. The board could rely on its current authority in both BPC 4081 and 4105 to secure access. Just want to confirm with the staff before I open up, if Attorney General's office that with the AG's office, the board would not require additional records authority for accessing functions done remotely. And I know I saw Christina on here, but I'll just punt it to you.
Yeah, I think we'll need to see where some of these policy questions go to then make sure, like on the auditing and everything, what the vision is. And then we'll have to check in with the AG's office to make sure that 4081 and 4105 actually cover all of the various elements that you're looking for. So we'll do that as soon as we understand exactly what you're looking for. If I'm understanding correctly, I think you're going to want every person that is involved in any piece of it, right? So anybody that touches. So if I'm understanding that correctly, based on the heads nodding, based on the floating heads, I can get in touch with the AG's office and just make sure that it's covered under 4081 and 4105, make sure that there's no holes in the law, and then get back to you.
Thank you, Anne. All right, next question. Should the pharmacy license or the license of the pharmacist in charge be subject to discipline along with the licenses of the pharmacy staff members involved in the event of misconduct that is associated with performing of remote processing functions? I know this is hard, but I believe the answer is yes. If you are taking that risk, you're taking the risk of allowing someone else to process remotely, you should be held liable for what happens. And so I just want to emphasize, I know some people don't have control over how this would happen. So that's why I feel strongly the PIC should be aware of what's happening and that would allow this to happen. And if anything goes wrong, unfortunately, PIC and the company and the pharmacist has to bear the burden of discipline. So with that, Jesse, your hand is raised.
Yes, I agree. As long as the pharmacist in charge is actually able to approve and be part of the decision making as to whether or not their pharmacy is participating in remote work, I'm hesitant to put liability on the PIC if that isn't the case. If they have no control over whether remote work is occurring at their pharmacy, I think it should
Right.
ultimately lie on the pharmacy license and whatever staff members are doing the remote work.
And the management and control of the pharmacy, right? Yep.
Exactly.
All right, Trevor?
Yeah, I'll plus one what Jesse said. With the, I do believe that there needs to be some level of mutual risk to spread it out, kind of what you were talking about, and whether or not that means if there's an initial violation that it rests solely on the pharmacy license, but second multiple violations under the same PIC might then also impact the PIC's license. Want to make sure the responsibility is spread out to avoid any potential abuse, any potential pressure that, again, if the PIC doesn't have that authority, then I feel like that's a problem in and of itself as far as spreading that risk around. But I agree that some method of accountability, maybe it starts with the pharmacy, and then if there's repeated offenses, it puts the license at risk of the pharmacist in charge, and so on, just to make sure there is a level of accountability at all levels to prevent abuse.
Thank you, Trevor. Okay, with that, we're going to go to the next question. Should the remote processing sites be licensed by the board using a license affiliated with a pharmacy license or with an automated drug delivery system? Or should the pharmacy be required to otherwise identify and register all remote processing sites with the board? So if this is depending on how the direction of where we go, obviously if we're allowing some work from home, it's not possible to register. I mean, I don't know how that would be possible. I think that there's a way that we could require in policy and procedure to list all the sites that pharmacists are working in each of the pharmacy or something along the line, but I don't know how there's no way that our board staff would be able to handle all the registration of all the sites where people work. I mean, that just, it seems not possible, but at least I think pharmacies should be required to notify the board locations of where it's happening so that they are required to say this is where it's happening. And so that if the investigation were to rise, they would be able to actually inspect those places. So I know that's still pretty tough, but that's where I stand. Trevor?
Yeah, I think it just ties into the last question in the sense I think it's a very interesting concept of remote processing sites having an affiliation with the pharmacy license, because I think that mutual accountability prevents any sense of abuse. If a pharmacy knows that their license could very well be revoked or at stake if the person they're trusting to do something remotely might abuse that, it would be a greater accountability measure to make sure that that pharmacy that's using the remote process will invest in the proper training, the proper IT security, the proper tracking to ensure that their license isn't put at risk. And so again, I kind of think this ties into with the previous one, that by making this like an affiliate license, like it says in this question, it could be a really key, interesting way of ensuring accountability, and so that these remote processing sites aren't abused in any way or lax in their security or processes, and that they're held to the same standard as they would if they were on site.
Thank you, Trevor. Jesse, any other thoughts? Okay. All right, next and last, at last, we've gone through pretty fast, actually faster than I thought. Board investigators have seen instances of pharmacies employing call centers to market directly to patients or prescribers, to cold call patients, and even to run test prescriptions for patients to test reimbursement, which may result in denials for patients at other pharmacies. The board authorizes remote order entry and or remote processing. How does the board prevent abuse? The scenario described in this question are one of the primary causes for my hesitation. And with expanding remote processing in the outpatient setting, we have seen too many enforcement cases that involve the activity described in the question. Granted, I understand we can't stop everything, the bad actors. I understand, we're not, that's not possible. But if we do ultimately determine that expanding provisions for remote processing are appropriate, that I would ask Anne to work with investigators, supervising inspector staff to identify conditions to safeguard against these illegal activities. What could we start so that we could prevent add some guardrails? So with that, any thoughts, Trevor, Jesse? All right. Okay, so with that, we're going to open up for public comments. And
Actually, Sung, as like a final note, or should we do this at the end after final?
yeah, we're gonna have that opportunity because
Okay.
I think that it's just three of us. Just because of the timeline and the materials that we have to cover at the board meeting, I just don't, but I need a little bit more, I think, direction from the board members as a whole. So I'm probably gonna talk to Anne to try to figure out if there can be some more broader questions that we could also ask at the board meeting. And then we'll try to see what steps we need to go next. So anyway, we'll have that opportunity. So,
Okay.
All right. Public comments, please, moderator, on questions, the last 5 questions.
Yes,
We've addressed.
Yes, the Q&A is now open. Instructions are on the screen. If you're logged in, click the question mark inside of the square, typically lower bottom right corner of your WebEx screen, and type the word comment in the text field that appears, and make sure it goes to all panelists before you click the send button. If you're calling in, press *3 from your phone to raise your virtual hand. No requests have been submitted. Would you like me to close the Q&A?
Yes, please. Thank you, Elizabeth. Thank you for enduring through all the public comments. It's tricky. Thank you all for discussions. And so having considered all these questions briefly, but obviously just 3 of us, so from this discussion, I think I will work with the staff to try to see where some consensus are, and then where we need some more clarification on where we need to go. And then we'll try to develop some language for our next meeting. It may be, the timeline may be a little tricky. So if you guys are okay with that approach, hopefully we can see where we land. All right, and with that, I'll open up for opportunity for you guys to say your thoughts on the global issue of this remote processing. So go ahead. Jesse, go ahead.
Thank you. Something we didn't touch too much upon was a final example that have different strength tablets that are the exact same color, and the imprint is almost identical. And it really takes that tactile opening the bottle and seeing it to really notice those differences. And I know personally myself, I've caught medication errors with mixed tablets that are the exact same size with very small differences in imprint. So that's a very big concern for me in terms of final verification for products. Also, just from a workload standpoint, I know there is the potential benefit of reducing workload for a community chain setting in which we're already understaffed. I also have a concern that this could potentially reduce the staffing even more if companies choose to continue hiring remote positions and reduce staffing even further in these brick and mortar pharmacies. So that was just the last two comments that I wanted to throw in there before we end.
Thank you, Jesse. Trevor?
Yeah, I think there's been some really good points raised throughout this, and clearly there's an importance, especially in a state like California, to make sure that we are accessible, being on the cutting edge, while at the same time making sure that being on the cutting edge does not diminish the quality of care for the consumers, which in the end is our mandate as a board. And so I think I appreciate how we ended this conversation on the last couple of questions, and because as you heard, like I raised a couple of my key concerns around data privacy, around stigma, around a lot of different aspects of items. And if pharmacies are willing to tie their license to the quality of this remote processing and the security of the data, and if any of those are found to be lax, that they're acknowledging that by having these remote processing, it'll be a reflection as if it were on the pharmacy premises and have the same consequences, if not potentially more so because it is not within the typical secure facility. That would alleviate a significant number, maybe not all, but a significant number of my concerns, to make sure that these pharmacies know that their fate, their license, is tied to the quality of these systems that are in place at their remote processing sites. So I really appreciate the significant feedback that's been given by our attendees. It's been listened to, it's been heard, and I definitely think there is a way forward on this. I think eventually it's obviously going to have to go to the legislature, but I think the conversation that we're having here will inform that legislative process. And as I think if we can have that kind of collaborative effort of making sure that we do the cutting edge, we make things accessible, we make the profession accessible, we can still do that while maintaining the highest quality of care for California's consumers. So I just want to thank you and thank the team for filtering all these questions, President O, and everyone. And thank you again to everyone who testified. It's long, but it's important. So thank you.
Thank you, Trevor. Thank you, everyone, for coming and speaking. I really appreciate your time. Understand that this is very near and dear to your heart and how impactful it is to your livelihood and your career. So we understand. Wish there was an easy way, but there is not. So we have to figure out a way forward. And so we'll definitely discuss this at a full board meeting next week. I'll have to work with Ann to figure out how to process that through, and we'll go from there. All right. With that, I think future committee meeting dates is April 5th, July 19th, and October 18th. And the meeting is adjourned. Thank you so much, everyone, for your participation, your time, and all the materials that you've endured through today. I appreciate it. I appreciate all of you and all the staff, all the work that gone in there. Thank you, and all the stakeholders for participating today. Really, really appreciate it. And hopefully we'll see you in a couple weeks. Thank you. Bye, everyone.
Thank you.